specialist in Ayurveda, avian spine and joint related disorders. Friends, today is World Arthritis Day, 12 October 2022. First of all, I want to share something very interesting to all of you. That is, you know how many population are right now, how many of population are suffering with arthritis in present days. So I want to tell you everybody, that is, according to WHO, almost 14 million people are suffering with rheumatoid arthritis or arthritis in abroad or India also. We are including all over the world. And most important means 1.3 crore patients are suffering with rheumatoid arthritis. That is not a very small amount of population. Nowadays, almost, if we talk about the Indian population, so 14% of Indian population are suffering with arthritis in India. You can understand 1.130 crore population India have right now, and 14% are suffering with arthritis. Can you imagine how the disease is increasing? And that is a fact. I was thinking at that time when I was preparing that I will join in the live session at World Arthritis Day. To all of you, I will tell everybody how this disease is increasing in our surroundings. That is very important. And why this day is celebrating, why we are discussing today, why we are here to introduce the thing, what is happening in your surroundings. So you have to be very careful and you have to be observe the thing very minutely. So first of all, I want to tell you about how the day is, how and why we are celebrating this day. That is very important, because arthritis is a disease which are given by which gives you the mental or physical disabilities also. Mental, why I am using this word? Just because of your physical disabilities. Lot of patients, I know, lot of people are suffering with disease. They are coming to my hospital for consultation. They are suffering with physical disabilities with the disease, but mental also they are suffering with mental disabilities just because of that physical problem, just because of that physical disease. Why we are celebrating this disease? Firstly, we need to give the awareness, or we need to spread the awareness to all over the people. Because why this day is kept on World Arthritis Day? Did you think about the reason behind this? So the reason is to give the awareness, to spread the awareness to everybody, that you need to understand how the disease and arthritis is increasing in your surroundings. So we need to prevent this disease. We need to give the proper guidance of the disease to everybody, that we can, if with this awareness, with this live session, if I am reaching out to the patient or any people who is suffering with disease, or in future they will enter with this disease, if with this live session they are getting some much relaxation or some much tips to recover from the disease or to escape from this disease. So this live is very helpful and it is very successful to everyone. So why it is giving physical disabilities? Why it is very important? Nowadays, diabetes, blood pressure, lot of diseases like HIV, cancer, it is also heart attacks. It is also increasing in life nowadays. Why we are connecting today for arthritis? Because it is also a disease. It is giving you the physical, or not from the vice versa, we can say mental disabilities also. So that is why we are celebrating this day, to give the awareness, to provide the awareness, to spread the awareness to everybody who is suffering with arthritis. And nowadays you all are connected. First of all, I want to introduce myself, that I am Dr. Avinash Singh Chauhan, Senior Citizen Doctor, Shivaya Hospital. And first of all, today is the World Arthritis Day, I want to say again. So fear, the country all over the world is suffering these arthritis. Now, since last, I think you all know about the COVID-19. If we talk about the last 10 years, so the disease, the ratio of the arthritis is increasing day by day. Still it is increasing. So it is not, this is a thing we need to worry about this thing, because if it is increasing, so ratio, the graph will increase. Okay, so now let's come on the introduction part. First of all, the theme also, government given, every year government given a theme. This time, this time what is the theme? The theme is, it is in your hand, take action. That is the theme. Why government given this theme this year? That means सब कुछ आपके हाथ में है अगर आप एक्शन लेते हैं आज से तो. That is the meaning of this theme. It is in your hand, take action. So according to the rheumatoid arthritis, if we talk about rheumatoid arthritis, so 1996 Rheumatism International, with an aim to combat that disease. They aim that to recover this disease. With that aim, they started from 1996 to control or to resolve that disease. One second. So that is the reason from 1996 they took steps. Why? Just because to control this disease. And if they didn't take that action, I think the ratio, if we talk about the today's scenario, the ratio will be very high, or in future it will increase if we are not aware about that things. To fight awareness gap, to provide the support, assist to the people, that to know that you are suffering with disease, to tell everyone, if you have initial symptoms of arthritis, firstly you need to connect to the doctor, you need to consult to the doctor. If you are suffering with any type of joint disorders, inflammation, any type of pain during movement, so firstly you need to consult, you need to contact your doctor. If you are aware, then you will connect. Otherwise, if you are not aware that things, that swelling it is happening to in your knee joint, so what is the reason behind this? You don't know about that things. So how you will connect to the doctor, and how you will know the reason why it is happening in your body? So the reason why I am here, to spread the awareness, to know the reason why it is happening to your body, to your joints. So first of all, I want to tell you about the arthritis. That is also very important, because nobody will know what is the meaning of arthritis. If you ask about me, so I want to tell you, arthritis have many types, almost 100 and 120 types of arthritis in our body. But mainly some are very common, just like arthritis. Second one is rheumatoid arthritis. Third one is psoriatic arthritis, and many more. These are the very commonest arthritis right now. So why we are discussing about the disease? So arthritis is the swelling and the inflammation of the part of the joint area. Means आपके जो joint होते हैं, अगर मैं simple शब्दों में बताऊं, that is the joint area. Knee joint, that is, if the inflammation or any type of swelling it is happening in the nearby, in the surroundings of the knee joint, that is called arthritis. Arthritis, earth is denote, if we talk about the arthritis, so it is made up of two types. It is made up of two words, just like earth and itis. Itis means inflammation and earth means joint area. So the inflammation in the joint, that we can say arthritis. So if the inflammation is happening in your multiple joints, that we can say, just like with the rheumatoid arthritis, it is happening. So in the multiple joint, small joint also, they are suffered with inflammation, so that we can connect with the rheumatoid arthritis or uric acid maybe, because today is the day of arthritis day, so we are discussing only the arthritic point of view. And if it is happening in the knee joint and your knee joint, your knee movement is restricted, so we can understand with the osteoarthritis. It is clear? Any questions you can ask me in the comment box. I will revert you and I will give you the answer. If you have any doubt regarding arthritis, because that is very important to all the perspective of the patient side also. So that is one more thing. I think you all know about the Shivaya hospital. We are working since last many years on arthritis, and the best part is the patient who is suffering with chronic and with the multiple joint disorders, we are treating such type of disorders without any cut injections and without any painkillers also. And the best part is their MRI with the help of Ayurveda and without any cut or injections. And one more thing, about the arthritis symptoms. Lot of doctors in allopathic science, they are giving the steroids, they are giving the painkillers, they are giving the NSAIDs. NSAIDs means non-inflammatory drugs to recover, to resolve the pain, but from the inner side, disease is increasing. So why it is happening? And after, to know the consequences of the painkillers, to know the problems, to know the side effects of the painkillers, after that we are taking steroids, after that we are taking painkillers. But in Shivaya hospital we are giving without any cut or without any injection, without any painkillers, and with the healthy lifestyle we are providing to everyone who is suffering from avascular necrosis, spine disorders, joint disorders since many years. So from here I want to tell you about the avascular necrosis also, because as we already know about avascular necrosis, I think before 1 or 2, after COVID. Am I right? If it is correct. So because I know after COVID the disease of avascular disease AVN in the hip joint, it is increasing, or it is not very uncommonest right now, it is very commonest. It is affecting of your shoulder joint, it is affecting on your elbow joint, it is affecting on your wrist joint. So but the most commonest joint is hip joint right now. So the main causes why it is happening, just because of lack of awareness. Because earlier it was there, but after COVID, why it is increasing? Why this disease is increasing so much and it is going up to the peak? Why it is not uncommonest right now? So the reason is lack of awareness. Only that is the reason. So that is why we are here to introduce the things to you, because I am celebrating, I know about the Arthritis Day, but you don't know. And you are sufferer right now, so you have to know about these things. Okay. So with the help of Ayurveda technique, advanced Ayurveda treatment, we are giving the treatment to the patient with the help of natural thing, with the help of Ayurveda. The aim of the Shivaya hospital is to treat such patients without any cut and without any injections, to give the healthy lifestyle without any surgical, without any heavy surgeries, without any costly surgeries. So that is the reason we are treating. Shivaya hospital is working with this type of aim to serve the mankind, to serve the patients without any, you know, without any extra costings and without any other surgical procedures. So how, what that is a very important point, that is how to manage the arthritis, sir. That is very important. Everybody is asking. I think you all in the live session, you all are connected to me. Why you are connecting to me? Just because of to ask the reason, sir, what is the prevention and how we can prevent the arthritis from here? Just I want to listen this thing only. So earlier we used to discuss about these things, and that is also very important. Okay, the thing which I am discussing from here, that is important, but earlier which I mentioned, that is also very important. So first of all, how you can manage the arthritic pain or arthritis. So I want to tell you some basic tips, just you can write down in the paper also. That is, first of all, you need to maintain your regular activities. You need to maintain your regular exercises. First one. Second one is to control your obesity. Okay, if you are obese, so you have to focus on your obesity also. Third one is to maintain that if your body, if you took any type of steroids or any type of medications for any type of diseases, so you have to avoid that painkillers, you have to avoid that steroid part also. Fourth one is you have to perform regular yoga and pranayam. These are the things why I am telling about the arthritis day, that if you are aware these things, so you will not interact with arthritis in future, and your future means your children and and earlier your grandfather also, if they are affecting with this type of disorders, so they will not suffer. Okay, so fifth one is what is very important nowadays, why the young patients are suffering with arthritis. Just that is fifth reason is very important. Just you have to write down, that is alcohol and smoking. Why you are just, I think you saw my lot of videos, and in that video I think you found that lot of patient in the age, if we talk about the age bracket, so it is all about 20 to 40. So they all are young. So the basic and the reason is alcohol and smoking. That is a very responsible reason why the younger youth are suffering with arthritis in present era. Earlier it was not there. So these are some basic tips. I think you already get that things very easily, and if you have any doubts, you can ask me in the comment box also, okay, or in the live session. Extra activities just like that, you can also do swimmings. Swimming is also, it's a very in the physical activities, if we talk about, swimming is the best. If you are doing, I'm not suggesting to everyone, I'm suggesting only that patients who's suffering with arthritis and who's suffering with avascular also. So you can easily swim, but you have to be careful what instruction I given to you. Just you have to be keep in your mind first, if you consulted to me earlier. Okay, so walking and cycling, jogging, these are the things you have to manage, and if you are doing, so definitely you will be escaped from arthritis in future also. And now, what problem we are suffering, what is the issues we are facing right now in arthritis form? That is lack of awareness. First of all, that we don't know about the arthritis, we don't know about the disease. If doctor is telling, if we are going to the doctor, if he is consulting to me or any other family member, so they are just writing the disease name, that is arthritis. So we don't know about that reason, what is this and which arthritis I am suffering. It is rheumatoid, it is psoriatic, or it is osteoarthritic. So we need to know. That is lack of knowledge. This is not proper, just because of lack of guidance. If doctor is giving the painkillers, you are taking, you are gulping regularly. And it is not one or two, three, four, five tablets, five painkillers, three painkillers from since last many years they are taking. That is just because of lack of ignorance, and they are destroying your internal organs also. And you don't know about the how it is, how they are happening, and what is the consequences it will be happening in your body. So in early stage, if we are aware about that things, if we are aware about the reasons that in early stage you are swelling with your one joint, so firstly you need to consult your doctor. If the doctor is giving you the painkillers, so you have to be aware about that things. You have in your mind the thing will click, okay, that it is a painkiller, it will not recover my disease, it will just give you the subside part only. So you need to be very careful. If somebody is writing the medications, you need to be observed that this is a painkiller, so I have to take, I will not take this medication for next couple of months or next couple of days. These are the things you have to be observed, and you have to be very careful about. Why I am discussing today, because it is a very important day. That is why I am telling to everyone. Okay, so I think you will get all that points what I am trying to understand, what I am trying to tell to everyone. So first and second one, that is management skills also. How you are managing things, and how you are, if you are suffering with arthritis, that is very important point. If you are suffering with arthritis right now, you are the sufferer, so how you can manage the things. Earlier I used to mention the things, but from some very important tips and some more important points also, and it will help you. I hope it will really help you out to resolve your disease, to resolve your arthritis. So second one is to control stress and mood also. If you are suffering with stress in arthritis, because you are suffering with disease and it is not reversing, okay, so your mental pressure, it is increasing. Just because of that reason, you are feeling with anxiety, you are getting depressed. Just because of that thing, your disease, it is totally stuck, and you are just stuck with the surroundings, just like negativity. Okay, somebody is telling you are suffering many years. What is the disease you are suffering, and it is not getting cured? Why? So it is increasing your mental. So you have to maintain your mental state also, and you have to be very free from these are the some words which are given by the surroundings. So you have to be maintain that things also. And mood, you have to be very free. That is why I used to mention earlier, that is, you have to perform yoga regular days. You have to perform pranayam in regular days. Okay, so to communicate with your better healthcare, that if you are going to the doctor, if you are going to consult to the doctor in allopathic science, they are giving you the painkillers, so you have to be aware about that things, and you have to be consult to the another doctor, that is that doctor which are giving the natural way of line of treatment, and without any painkillers they are resolving your issues. So you have to consult to your best doctor, just like Ayurveda, or you can go with the homeopathic also if you are suffering with arthritis. So that is, you have to communicate with the best healthcare, best doctor. Okay. Any one more thing from this arthritis, I want to tell one medication, one health supplement that will help you to resolve your inflammation if you are in the early stage of arthritis. So first one, first and last medications I am telling you, that is very, very important, and that will be the very beneficial to everyone who is suffering with arthritis, and which you want to prevent also. It will be a very helpful for you also. So that is Shalaki. Shalaki is one of the most finest medication in arthritis. Or you can also take Gugul. That is also a very good medication in joint inflammation or to maintain the cartilages. So Gugul and Shalaki, these are the two medications, or you can in the form of powder also you can consume. If you are unable to take these medications in the form of tablets, so you can take it in the form of powder also. Okay, So first of all, you have, I think you may, I share a lot of information about regarding arthritis in the day of Arthritic World Arthritis Day 2022. And from here you have to be aware to everybody who is suffering with arthritis, and to each and every person near to your society, near to your near to your place. If he is suffering, if the any person, any family member, they are suffering with this type of disorders, so you have to share that video to such patients or such families, that if we are able to aware only single person in this day, so that the motive of this live session, it will be a very successful. I will think, and I will observe that my awareness program and my awareness live session, it will be a very helpful, and I will be very satisfied when you will share this video to everyone. So join your hands, and to everybody just share that video to aware such person who's suffering with arthritis right now. So I am now coming back to the live question answer sessions. Okay, if you are asking about the things. Okay, so that is very important to line of selection, the line of treatment you are selecting. If you are going towards the Ayurveda, so that is very important. You have to be take patience, calmness if you are taking Ayurveda treatment, because it will cut the root of the disease. Okay, first of all, you have to be very to the point. You have to be very to the point that if you are taking with the Ayurveda treatment, so you have to be very to the point that this treatment, this line of treatment, it will cut your roots of the disease. Okay, so it will take time, but definitely one day, without any side effects, you will recover from your arthritis. So that is the thing you have to be maintained. And if you are taking any Ayurveda treatment, so you have to take patience and calmness, and you can observe the things. It will recover day by day. You will feel there is a change in your disease, and you will feel that day by day you are recovering from your arthritis, from your disease. The line of treatment and selection of the treatment is very important. So you have to be choose that thing. If you are going towards Ayurveda, if you are going towards allopathic science, so you have to be observed which line of treatment is good for my disease, which line of treatment is good for my future also. Okay, no, it doesn't matter it is taking time or it is not taking time. It doesn't matter. The matter is that if it is recovering from the roots, so that is a good line of treatment. That is the best line of treatment. Okay, so I'm just coming back to the point, that is the patient who's suffering with disease, and a lot of patients are asking in the comment box. So I'm just coming to the first one is, one second. Okay. Can you give me a phone? 1 second. Okay. First of all, Arman Khan, Fatima Ali. Okay. Shailin Chauhan, hello Shailin Sinchana, good morning Sinchana जी. यनवी तनवार, सर कभी कभी चला नहीं जाता है, कभी वापस आ जाते हैं, पेन वापस आ जाता है, ऐसा क्यों होता है? देखिए ऐसा है यानवी तनवार जी, अगर ऐसा प्रॉब्लम आ रहा है, फर्स्टली आपको समझना होगा कि क्या रीज़न है, किस वजह से ऐसा प्रॉब्लम आया, एंड कैसे आपको कोई और रीज़न तो नहीं है, कुछ खाने में ऐसा तो नहीं आया, ठंडी चीज़ें आपने ले ली हो इस वजह से आ रहा हो ऐसा पेन, तो आपको ऑब्जर्व करना होगा ये. गुड मॉर्निंग एवरीवन. मोहित सर, मोहित हरिद्वार से, मेरी कंडीशन वैसी है, बहुत पेन हो रहा है. मोहित जी आप मुझे आफ्टर दिस लाइव सेशन आप मुझे व्हाट्सअप कर सकते हैं. गुड मॉर्निंग सर. नंदू यादव जी, किस जगह पेन आ रहा है मुझे बताइए. मेफा टाइम आई हैव कोलैप्स्ड फीमर हेड. Arman Khan, you can share me your report on my WhatsApp. My WhatsApp number is 9424842988. सर मेरा एवियन पेन कर रहा है, क्या करूँ? चंदू रॉय जी, आपने कोई रिपोर्ट कराया तो मुझे व्हाट्सअप करिए, मैं रिपोर्ट कर रहा हूँ. पुष्पा जी जय श्री महाकाल। शरण चौहान पेन हो गया है तो मुझे शैलेंद्र चौहान जी आपको रिसेंट रिपोर्ट एक्सरे आपने जो कराया मुझे व्हाट्सअप करिए। मैंने आपको अपना एक्सरे भेजा अभी तो। ओके पुष्पा जी मैं रिवर्ट कर रहा हूँ आफ्टर दिस लाइव सेशन। रिफत रहमान सर गुड मॉर्निंग सर, इज इट ओके टू हैव स्टमक पेन while having Ayurvedic medication initially? No, it is not. It is not okay. But I think the reason is why you are suffering with the stomach pain. The reason is the diet plan, because you are starting with a new diet plan with a new line of treatment. So that is why your stomach is paining. Okay, so no need to worry. Just give some more time. After that, you will, when your body will habituate for that, so it will automatically subside. Rahul Kumar ji, good morning. So Zareen Ali, I have fourth stage avian from and femur head has collapsed. I just took regenerative therapy last week. Can you help? I also send you my reports. Okay, so Zareen Ali ji, kindly share me your report on my WhatsApp number. My WhatsApp number is 9424842988, or you can mail me also info@shivayahospital.com. That is our hospital mail ID. ऋतु कश्यप जी गुड मॉर्निंग। दीपा अमरे, मैं सर पेन अभी भी है, थोड़ा चलने में थोड़ा पेन होता है और नींद में भी पेन आ रहा है, एसिडिटी होती है, एक्सरसाइज करते समय पेन होता है। तो एक्सरसाइज दीपा जी थोड़ा सा कम करेंगे, थोड़ा सा कुछ जो मूवमेंट्स है इसमें रिस्ट्रिक्शन आ रही है आपको, उसमें थोड़ा सा कम करेंगे। बाकी इसके अलावा आप एसिडिटी के लिए आप कंटिन्यूस वहाँ पे ऑयल से मसाजेस कर सकते हैं, और एसिडिटी के लिए आप एंटासिड्स जस्ट लाइक अमृत मिश्रण आप ले सकते हैं उसमें 2 times इन अगे मॉर्निंग एंड इवनिंग। विशाखा सर मुझे नी में दर्द होता है, क्या करना चाहिए? एवियन ग्रेड 2 एंड ग्रेड 3 है। विशाखा जी काइंडली शेयर मी योर रिपोर्ट। इफ यू आर सफरिंग विद सेकंड और थर्ड ग्रेड vascular necrosis, so no need to worry, just kindly share me the report from my WhatsApp. Definitely I will revert you, and in this condition we are treating such all the patients and they are just getting the results with this treatment. So no need to worry, just share me the report on my WhatsApp. अरमान खान हेलो सर, आप पैसा सब लेना कंपल्सरी? बिल्कुल अमन, लेना पड़ेगा आपको। फैक्ट मून रिपोर्ट्स मैं आज रिवर्ट करता हूँ आपको, आप चेक करिएगा व्हाट्सअप। गुड मॉर्निंग, गुड आफ्टरनून सूर्य लता जी, गुड आफ्टरनून। योर प्रिस्क्राइब मेडिसिन गिवफिक्स शल्लाकी MR is finished. How long I should take the medication? The pain is occurring in my right shoulder, elbow and fingers. You will continue with the shallaki. There is no side effect of this medication in your body, so you can easily continue with that. आपका स्टाफ लोग आपसे बात नहीं करा रहा है, बिल्कुल आप मुझे व्हाट्सअप कर सकते हैं, मैं आपको रिवर्ट कर रहा हूँ। असलम तारिक हाय सर फ्रॉम पाकिस्तान, योर पेशेंट असलम तारिक, आई एम स्टिल वेटिंग फॉर योर काइंड confirmation of my medications delivery to Oman. Definitely Aslan, I will revert. Firstly we are in the background, we are talking to the courier services if is there any possibilities, so definitely I will share the courier to your place. How long should I take the medication? Please reply Aslan. Just because of that you are unable to contact to me and you are unable to visit to our hospital, just because of that reason you are taking medications I am sending to your place. So you have to take some patience, because you are following only the guide plan and the exercises and medications. The treatment is must in these conditions. If you are, just because of that reason you are unable to, maybe I don't know about the reason, but you are unable to come to my hospital, that is why you have to take medications in a couple of from next couple of months also. From here I am unable to say that this how long you will take medications. Similarly the pain is the spine, mind, ankylosing spondylitis. Yeah Suryata, I know, Suryalata ji, I know very well you are suffering with ankylosing spondylitis, so you can continue with the shalaki. There is no side effect of this medications, so you can continue with that. SK सर मुझे स्कूल विजिट के लिए आना है, लेकिन मेरा एग्ज़ाम है 15 को 16 को को आऊँगा, लेकिन मेरी दवा ख़त्म हो गई है, क्या करूँ? भेज दीजिए, हिंदी में बताना सर। बिल्कुल SK जी, मैं आप एक काम करिएगा, अगर आपको 15-16 को आना है तो आप मुझे व्हाट्सअप करिए। अगर अभी आ रहे हैं, इस 15 अक्टूबर को आ रहे हैं, तो बिल्कुल आ सकते हैं आप, कोई इशू नहीं है। आप 2-5 दिन के लिए मेडिसिन स्टॉप भी कर रहे हैं तो कोई प्रॉब्लम नहीं आएगी। सर बीना यादव गोरखपुर से बोल रहा हूँ, एवियन बोल रही हूँ। एवियन का दर्द कम है लेकिन कमर में दर्द हो रहा है, ऐसा क्यों हो रहा है? मेरी दवा समाप्त हो गई है, 1 मंथ की दवा चाहिए। ओके नो प्रॉब्लम। कमर में दर्द मे बी द रीजन इज जस्ट बिकॉज ऑफ दैट लिम्पिंग, इट इज द प्रेशर इट इज क्रिएटेड एंड इट इज एक्साइटेड फ्रॉम द स्पाइन, इट इज फ्रॉम द स्पाइन, मे बी दैट इज द रीजन, और सम रीजन मे बी जस्ट बिकॉज ऑफ दैट नर्व compression, or just because of another reason that is just because of muscle spasm. हाँ, हो सकता है कि मसल स्पाज्म हो आपको, इसकी वजह से आपको पेन आ रहा हो, ये भी एक रीज़न हो सकता है। तो उसके लिए आप ऑयल एप्लीकेशन कर सकते हैं और मैं मेडिसिन आपको आपके एड्रेस पे भेज दूंगा। आई जस्ट डिड रीजनरेटिव थेरेपी, कैन आई still cone and do treatment with you? I need you to wait and take your medications. Still come and a collapse in your head take shape again. Yeah, Amar Arman Khan ji, kindly share me your report if you are taking any type of regenerative therapies. So just kindly I am advising you to go for recent X-ray, and that X-ray you will send it to my WhatsApp. So I will revert you accordingly. Okay. मयूर सूदनावर, सर मेरा एवियन पेन दर्द कर रहा है और सेकंड टाइम आना पड़ेगा मुझे, सेकंड मंथ हो चुके हैं, 2 मंथ हो चुके हैं। बिल्कुल मयूर जी, आपको ट्रीटमेंट के लिए आना पड़ेगा यहाँ पर, और इसके लिए आप अपॉइंटमेंट भी ले सकते हैं और मुझे कॉल भी कर सकते हैं। I send my reports for 4 days back, but no response. Arman Khan ji, kindly just write down your name with Arman Khan on my WhatsApp. Your message will show on the top, so I will revert you after this live session and you will get your answer. ओवरऑल नॉलेज सर, मैं फाइनेंशियल प्रॉब्लम की रीज़न से हॉस्पिटल नहीं आ पा रहा हूँ, बट यस मैं आपकी मेडिसिन अभी भी फॉलो कर रही हूँ। वेरी गुड। अमर खान सर, what diet should be taken in avian and arthritis for stage? Yeah, definitely. It is very important. It will play a very important role for your recovery in your disease if you are suffering with avian or arthritis both. JSM राणा सर, लेफ्ट हिप की सर्जरी हो चुकी है, अब राइट में पेन होता है, क्या मैं दोनों पैर से एक्सरसाइज कर सकता हूँ या ओनली वन पैर से? जिस पैर से सर्जरी हुई है, जिस पैर की सर्जरी हुई है आपकी जयस जी, उस पैर से आपको एक्सरसाइजेस परफॉर्म नहीं करनी है। रेस्ट इधर सारे अब जो भी मैंने बताया हुआ है आपको, आपके जिसमें ऑपरेशन नहीं हुआ है, इसका ट्रीटमेंट मैंने किया था, उस लेग से आप सारी एक्सरसाइज परफॉर्म कर सकते हैं। सचिन पाल सर, आफ्टरनून, मेरी कमर में बहुत पेन हो रहा है, मैं आपको फ़ोन कर रहा हूँ, आपके बंदे बात नहीं कर रहे हैं मेरी। सचिन पाल जी, आप यू कैन जस्ट लीव मैसेज ऑल्सो इन माई व्हाट्सअप। अगर आपको ज़्यादा पेन आ रहा है तो मुझे व्हाट्सअप भी कर सकते हैं, बिकॉज ऑफ माई बिजी शेड्यूल आई वॉज एट दैट टाइम आई वॉज अनेबल टू कनेक्ट टू यू डायरेक्टली, so that is I am just telling you the another line of connectivity, so that is you can leave a message in my WhatsApp, so accordingly I will revert you in my voice also. सौरभ जी सर, मैंने मॉर्निंग वॉक शुरू किया, ओके, बहुत कम करना है, ज़्यादा नहीं करना सौरभ। अरमान खान आई ऑलरेडी सेंड 3 days बैक, जस्ट राइट डाउन योर नेम ओनली अरमान खान। प्रणव पनव सूरी सर, हेलो सर, हाउ आर यू? आई एम गुड सर, मेरी मेडिसिन खत्म हो गई है, सेकंड विजिट के लिए आना है, चलने में पेन आता है आगे से, बट बहुत आराम है सर, नेक्स्ट मंथ में आ रहा हूँ, बट सर सेकंड हिप में क्यों पेन आ रहा है? नो प्रॉब्लम पनव सूरी जी, यू आर कमिंग टू माई हॉस्पिटल, सो वी विल डिस्कस टुगेदर। एंड क्या रिकवरी है, आपने पहले पता कि आपको रिकवरी लग रही है, तो आप कंटिन्यू करिए साथ में और आपको रिलीफ मिलेगा उसमें। और त्रिलोक सर, मुझे बहुत आराम मिला है, क्या बाइक चला सकता हूँ 2 से 3 किलोमीटर? त्रिलोक जी, बाइक की जगह पर आप स्कूटी ड्राइव करें, ज़्यादा बेटर रहेगा, ज़्यादा अच्छे रिजल्ट्स रहेंगे और कोई साइड इफेक्ट और कोई भी रिस्क के चांसेस उसमें बहुत कम रहेंगे। सर, लाइव सेशन खत्म होने के बाद हम आपसे कॉल पे बात हो जाएगा ना? मेरे नाम आकाश है। ओके आकाश, आप यू कैन कॉल मी आफ्टर दिस लाइव सेशन, मैं कोशिश करूँगी आपसे कनेक्ट कर पाऊँ, और आप मुझे व्हाट्सएप पे वॉइस मैसेज भी कर सकते हैं। नमस्ते सर, इंश्योरेंस का पेपर जो हॉस्पिटल से मिला था उसका भुगतान कहाँ से होगा सर, प्लीज़ बताएं। फर्स्टली सूरज जी, आपकी जो इंश्योरेंस कंपनी है आप उनसे बात करिए, जिस चीज़ का इंश्योरेंस आपका है, जिस कंपनी का इंश्योरेंस है, आपको जो डॉक्यूमेंट आपको हॉस्पिटल से मिले हैं वो आप उनको सबमिट कर दीजिए, आपका इंश्योरेंस के बारे में आपको पूरी इन्फॉर्मेशन वो देंगे। सर जी, मैं बैठ सकता हूँ या नहीं बता दीजिए मुझे। आप बैठना मैंने अलाउ किया हुआ है, आप बिल्कुल बैठ सकते हैं, बस ज़मीन पर आपको बैठना अलाउ नहीं है। शॉर्टनिंग है आपको अरमान खान जी, आप कोई प्रॉब्लम नहीं है, आप मुझे व्हाट्सअप करिए आपकी रिपोर्ट, मैं रिवर्ट कर रहा हूँ। शुड आई कंटिन्यू द डाइट प्लान? माय हस्बैंड इज आल्सो हैविंग पेन इन जॉइंट, जस्ट कंटिन्यू विद द डाइट प्लान। द डाइट प्लान इज वेरी गुड, यू कैन कंटिन्यू फॉर लॉन्ग ड्यूरेशन एंड फॉर लॉन्ग टाइम ऑल्सो, देयर इज नो साइड इफेक्ट, सो यू कैन कंटिन्यू विद द डाइट प्लान इजीली। सर, प्रणव सूरी सर, मैं सम्राट सूरी फ्रॉम हिमाचल। सम्राट जी, प्रोफाइल में नेम, ओके ओके ओके, नो प्रॉब्लम, अवॉइड करेंगे, बट कभी कभार अगर बहुत इंपॉर्टेंट है तो आप बाइक ड्राइव कर सकते हैं, बट हो सके तो स्कूटी आप परचेज करें बाइक की जगह पर. ओके, सो questions, all questions are done, and I think you all get. Sophia Sunny, so what about my case hip? Will it be possible to restore? Okay, Sophia ji, kindly share me your report on my WhatsApp. I will revert. Sir, as I am following your diet chart and exercises and medications, my left leg is almost healed. Now only right leg has pain issues, but improving. Please keep posting videos and exercises. Thank you. Sure, definitely. You will get my guidance in my YouTube. A lot of already uploaded in the YouTube, so you can get all the information easily. And if you have to ask any other question, so you can ask me in the WhatsApp, and you have my number, and you can ask me over there also. Okay, thank you so much, all of you, and maybe this day, this awareness program, everybody will share, and I want to listen only that thing that you will share, and you understand that live session, and you will share to everyone, every family members, that in future maybe this will be a very helpful to everyone, and it will give you the awareness program, and it will give you the awareness to each and every person who is suffering with arthritis, or in future those patient who, that will be the prior patient, if the families are suffering with joint disorders, means just your grandfather, your grandmother, and some arthritis is just like genetic disorder, say rheumatoid arthritis. It is a very commonest right now, and it is also a very genetic disorder. So it will not transmit to your children. So for that you need to share that video to everyone, that we can aware if the early symptom is you are found that some early symptom in your joints. So firstly you have to, with that you will be a very aware what is the first symptom or first line of treatment in arthritis. So in earlier stage, if you are taking treatment, so definitely you will recover and you will resolve from the disease. Okay, so सब मेडिसिन बुलाने के लिए पहले रिपोर्ट सेंड करना पड़ेगा. मेडिसिन सेंड कर दोगे? जयेश जी, आप मुझे व्हाट्सअप कर सकते हैं, मैं आपको उस हिसाब से आपको एडवाइस कर दूंगा. सर मैं ट्रक चला सकता हूँ? ट्रक चला सकते हैं, कोई इशू नहीं सर. मेरा पैन मूव करता है, कभी राइट कभी लेफ्ट. ओके, नो प्रॉब्लम. आप मुझे व्हाट्सअप करिए. अगर पेन मूव कर रहा है तो जस्ट बिकॉज ऑफ दैट एंकलाइजिंग स्पॉन्डिलाइटिस, इसमें ऐसा होता है, देखने को मिलता है. ठीक है, वो सर 1 महीना हुआ है, दवाई ले रहा हूँ, बहुत आराम है. गॉड ब्लेस यू आशीष शिंदे, गॉड ब्लेस यू, टेक केयर. मेडिसिन लाइफ टाइम करना? नहीं, ऐसा कुछ भी नहीं है. एंकलाइजिंग स्पॉन्डिलाइटिस में कुछ टाइम के बाद मेडिसिन स्टॉप कर देता हूँ पेशेंट के. So thank you so much all of you. If you want to connect with me in the official mail ID, that is info@𝒂𝒑𝒑𝒐.com, or you can also connect with me through my official website, that is www.𝒑𝒑𝒐𝒊𝒏𝒂𝒂𝒏. Shivaya spelling as 𝑖VAYAHOSPITAL. Okay, .com. ये आप, that is my website, ऑफिशियल वेबसाइट. आप उससे हमारे हॉस्पिटल के बारे में सारी इन्फॉर्मेशन ले सकते हैं. एंड आप चाहें तो हमारे यूट्यूब पे, जिस पे आप मुझे लाइव देख रहे हैं यहाँ पर, तो आप उस लाइव में से साउंड भी नहीं आ रहा है. 1 सेकेंड, आई हैव टू चेक. वी यूज्ड टू डिस्कस अबाउट दीज थिंग्स. फर्स्टली आई हैव टू चेक. ओके, क्या मुझे लाइव देख रहे हैं यहाँ पर, तो आप it is here. Just kindly check your voice section. It is clear right from here. Gaurav ji, good afternoon everyone. So Rajat Agmane sir, I was trying to contact you since last 6 days. Please respond. Okay, you can also get my voice record in your WhatsApp. You can, if you are unable to connect with me directly. There are a lot of patients want to connect, want to talk to me directly. So it is not very easy to for me, because of that patient, because of that my schedule. So if you want to ask something, so you can share your voice record in my WhatsApp. I will revert you accordingly in my voice. Okay, you get that answer easily. Zareen Ali ji, you are calling from last. Yesterday I called a lot of patients from before. Yes, yesterday before yesterday I called a lot of patients. I talked to yesterday lot of patients. So why, if you have any doubts, any questions, you can ask me in the WhatsApp. And why I am live here, so you can ask me any, if you have any doubts, any questions, you can ask me here. Okay, so Zareen Ali ji, just tell me your question if you want to ask any question. I already shared my voice messages. Okay, Zareen Ali ji, you can ask me here. I am live right now. You can ask me if you have any questions in your mind. 𝒂𝒑𝒒 sir, I send you the MRI reports 4 months of treatment. Kindly tell me further medicine needed. Okay. Yeah, 𝒂𝒑𝒒 ji, I already reverted to your MRI reports. You can check it first. If you have any questions after that, you can ask me in the WhatsApp also. And yes, you need to continue the medications from here. Gurdeep Singh ji, I am send reports, document details, but till yet I have not received any. Send on WhatsApp Saturday and regular day. Okay, just Gurdeep ji, kindly just write down your name. It is a very simple process. Just write down your name, Gurdeep, and you can take a screenshot of this message and you can share in my WhatsApp directly. I will revert you, and if I revert it to you, just leave a message, or you can reply on that message, or you can just point it with that message, and I will get your number on the top of the WhatsApp. Okay. November first week, are you available? Yeah, I am available. I am planning to come for treatment. This will be my first visit. 𝒂𝒑𝒑𝒐𝒊𝒏𝒂𝒂💐 Shiva Shetty. Okay, no problem, Shiva Shetty ji. You can come to my hospital. I am available in November. Okay, sir, मैं 4 रोटी और ब्राउन राइस खा रहा हूँ. कोई प्रॉब्लम तो नहीं, बिल्कुल कोई इशू नहीं है, आप खा सकते हैं, कोई प्रॉब्लम नहीं आएगी. My femur had collapsed. I sent it to my reports. I have half-inch shortening in right leg. Just write down your name only, Zareen Ali ji. And if you are suffering with shortening of the leg just because of that collapse, so it is a very critical condition. So firstly, if just you are suffering with the disease, kindly share me your proper X-ray. If you get any recent X-ray, if you have, you can share in my WhatsApp. Accordingly, I will tell you. Where is your hospital? So my hospital is located in Uttar Pradesh, in between Lucknow and Kanpur. The city's name is Unnao. So you can easily get in through my official website, that is 𝒊𝒏𝒂𝒏𝒂𝒉.shivahospital.com. I get it already. Okay, no problem, Zareen Ali ji. Just write down your name only. Okay, I am reverting after this live session to everyone who didn't get answer since last many days. Okay, and so much for joining me live in the live session. That was very important live session, and I hope it will be really helpful to everyone. Thank you so much. God bless you, all of you. Thank you.